The small country of Ghana on the southern coast of West Africa is a kaleidoscope of humanity, artistry, history, and tradition. In October 2007, 15 medical and other professionals, including 12 from Akron Children's Hospital, traveled to Ghana to provide healthcare and support services to Margaret Marquardt Hospital, a 180-bed medical facility in the village of Pondo. The team called themselves Providence Ghana Aid.
I chose Margaret Marquardt Hospital because that is where I lost my daddy. That was in 1972, when I was just 7 years old. And he died of hypertension and jaundice. My strong belief, however, is he could have been saved. But for the lack of proper medication and lack of medical know-how at the time, he lost his life to these illnesses. And my dream has been to give a facelift to whatever happens at Margaret Marquardt Hospital.
In addition to Father Olala, the team comprised one surgeon, a pediatric intensivist, a psychiatrist, 6 nurses, 2 occupational therapists, 1 physical therapist, an industrial engineer, and a public relations specialist. Upon their arrival, the team met with the staff to determine how best to meet the vast needs of the hospital community.
The people there really are dedicated to what they do and to caring for the patients, but they do it in a setting where their resources are very limited.
The town of Pondo is fairly large. The region that hospital services is tremendous, and I think they are so lacking. I mean, here even at Children's we think we're lacking in staff and resources, and it's nothing compared to what they're lacking in.
And these limited resources affect every aspect of the hospital, from the lack of equipment and basic supplies to how medical care is delivered.
Here, nurses bathe their own patients, they feed their patients, they take care of them, they change them, and in Ghana the family takes a big role in that. So nurses in Ghana give medications, but only if the patients can afford it, and here we provide care to everyone, no matter if they can pay or not.
In most cases, medical care in Ghana is a cash and carry system, meaning patients must either pay for their care prior to receiving it, or in an emergency situation, pay the medical bill before leaving the hospital.
You know, you have a child or a parent that comes in for care and they can't pay, so they get turned away. Or if they are able to scramble up money, through their family, and they can only, maybe afford half of what they really need. So if I were able to change something, it would be that, no matter what social standing you are, no matter how much money you have to give, or what resources you may or may not have, that you get fair medical care, no matter what.
In response to this healthcare crisis, the Ghanaian government introduced a national healthcare system in 2002. Unfortunately, since the average wage is less than $1 per day, most Ghanaians cannot afford the nominal annual premium.
Ghanaians in the main are poor. And if you go to the hospital, you have to pay before you are treated. That's cash and carry system. In hospitals that would not be merciful enough to treat a patient and wait for some kind of payment by installment, patients simply do not get treatment. They go home and some die.
During their stay, team members provided patient care on medical and surgical wards, performed surgeries despite unreliable electrical power, taught cardiopulmonary resuscitation or CPR, staffed a wound care clinic, and established physiotherapy services which prior to their visit did not exist.
In actually walking around the hospital, I was just really taking it all in and completely overwhelmed at how people would just be staying in bed and sitting in bed, and I just immediately saw potential for what these people could be doing and how therapy could be used.
In addition to rounding on medical and surgical wards, the therapists held training sessions with staff throughout the hospital. And although they treated hundreds of patients during their stay, they took a special interest in one particular young lady.
She was a lady my age that came to the hospital and was there for about a month before we came. She said, "I'm paralyzed. I came here and they don't know what's wrong with me, and I can't walk, and I don't know when I'm going to be going home." So we started to examine her. We gave her a walker, and she slowly started to walk with the walker, straighter and straighter up. And I've taught her a lot of exercises and positioning, what she should do. The last day, her mom came, found me, and said, "You have to come." So I said, "Okay, what's going on?" She was sitting on the bed, and she said, "My daughter wants to show you something." And I was handing her a walker and said, "Okay, show me how good you got." She's like, "No walker." I said, "No, you have to use the walker." "No walker." And she just stood up and was cruising along the whole room, straight as a model, and everybody in the room started to clap. And she said, "I'm going home today."
The team also helped the staff understand how emotional health can affect the physical health of their patients.
My experience in working in psychiatry in different states in the United States, I realized that every place I went, there were psychiatric needs, and sometimes they weren't always addressed, but they were always there. My guess was that with the HIV/AIDS crisis in most of sub-Saharan Africa, that there were children and families displaced and depressed and mourning, and that their needs were probably not being addressed.
They also had the opportunity to see the fruits of their labors firsthand.
I was asked to teach cardiopulmonary resuscitation. I had the opportunity to actually watch them do it on a patient. I was teaching the class, teaching them on the mannequin, and in the middle of teaching the nurses and staff from the medical ward, someone came in and said there was an emergency, and two of the nurses ran out. They came back, they got me, and when I went in there, they were actually doing CPR on a patient in the medical ward. And this was, I literally had just taught them probably 2 minutes before, and now they were on the ward doing it.
Providence Ghana Aid also established a wound care clinic that helped to reduce outpatient wait times at the hospital.
It was one room. There were very little supplies that we had. Basically what we had to dress wounds, it would be iodine or some saline to do like a wet to dry dressing. And that's what we could give the people that couldn't pay for anything. There were some other dressings that we could get if they did have insurance, but that was far and few. I got to sort of get back to the basics of what nursing is, where you don't have all this technology and you're dealing with a person and their need.
And although many of the team members expressed how much they were changed by this experience, none of them could have anticipated the impact of a young boy named Joshua Darku.
He is a 13-year-old boy that was burned the second day that we were in Ghana. He was helping his teacher install FM radio at his house, and the teacher was holding onto a bamboo pole that had a wire connected to it. Joshua was holding onto the wire, and the teacher accidentally touched an electrical wire with this bamboo pole that had the wire connected to it. We estimated between 30 and 35% of his body was burned. His burns were pretty bad, and we could tell that from the get-go.
Joshua's family had no insurance. Knowing that his life hung in the balance, the team decided to adopt Joshua and pay for his treatment. They quickly exhausted their resources, however, and it became clear that additional monies were needed.
We knew that we needed to make contact with somebody at home, and so it came to our mind, Aluminum Cans for Burn Children, ACBC, and they stretched their funds across the world here for us and provided the money for the care that Joshua needed.
Everyone, thank you.
You're welcome, Joshua.
again, if we wouldn't have been there, he wouldn't have made it because he wasn't treated because of no insurance. And just seeing the whole process and what little money we really did give and how much it did for him. He's going to be okay after all because we were there. It was meant to be.
The impact that was made by Providence Ghana Aid will probably never be completely known. What is known, however, is that lives were saved, people were changed, and this is just the beginning.